that they can be included. So it sounds like Dr. Newman is.
So if we could all stand up and give a huge round of applause for our president and CEO who is coming down. He is accompanied by Martha Pera, our Vice President of Clinical Support Services. Dr. Newman and Martha, in the spirit of transparency, we wanted to just start to kick this off and make sure that you had the appropriate welcome. So once again, thank you so much for being here. I'm not, okay. Actually, we're going to let Dr. Newman have the closing comments and wrap it up, and we will go ahead and get started with this really wonderful, wonderful panel.
When I'm ready.
Okay, very good. So we have two very special patients here, and I just had a chance to meet them. If Katie Johnson and Maddie Curtis could both come up, and I know you're going to be introducing yourselves, but these are patients, very important patients to Children's National who have recently experienced both inpatient and our ambulatory services. And they're going to introduce themselves and tell you a little bit about themselves and about their experience, and then they're going to talk with us about the things that went well and some of those things that we could change and we could do better here at Children's. And then we'll have an opportunity to have an open dialogue. So Katie and Maddie, take it away.
So hi, I'm Katie, and I'm 15 years old, and I started feeling sick 4 years ago, and I started with stomach pain and nausea, and it just wouldn't go away, and we decided to see a GI doctor, and they did testing, and all the tests were normal, and they couldn't figure out what was wrong, but then I developed tachycardia, and we were sent to a cardiologist who diagnosed me with POTS, which is postural orthostatic tachycardia syndrome, and it's when, like, the blood from your brain rushes down to other parts of your body, and that can cause lots of different symptoms, too, which can affect me, too, in my daily life. So then around last year, we got a test that showed I had median arcuate ligament syndrome, which is when your median arcuate ligament is wrapped around your celiac artery, compressing the blood flow to your stomach, which can cause a lot of pain and nausea. And I came here for my surgery last April, a laparoscopy surgery, and then after that, like, I wasn't improving that much, but I had to get a stent to keep my artery open, and then last August, I finally got a full ganglionectomy, and which is when they take out your celiac ganglion, and so they took that out and finished cutting the ligament off the celiac artery, and now I started getting better since last December, but now I started experiencing some symptoms again. But okay, so yeah, so my twin sister is on the right, and that's my dog Georgia, and my twin sister has been nothing but more supportive, and she's always there for me, and she's my best friend. Yeah, and she's right there. And that's Scout, our new dog, and they bring me happiness every day. And that's me and my cheer team. I think we won counties in that picture, and I really like to cheer, and me and my friends do it, and it's one of my hobbies. Okay, so the symptoms I've had are upper epigastric pain and nausea and reflux. My diagnoses are the median arcuate ligament syndrome, the POTS, gastroparesis, and I also have kidney stones. Okay, and in the last 4 years, I've seen 14 doctors, which have helped me a lot. It's just been hard finding the right specialty since my disease is so rare, but we finally got a good group, and I visited 7 hospitals in 3 states, and I've had multiple procedures and 2 big surgeries. I like Children's National because the staff made me feel very at home and not like you're at a hospital, and they were very nice and accommodating, and they were very helpful, and it was a nice hospital to be at, since most of the hospitals were not that I've been to. Yeah. They were just centered around kids, and I like that. Thank you.
So, hi, I'm Maddie Curtis. I'm 17 years old, and I'm a senior at Oakton High School in Vienna, Virginia. I'm a Chiari malformation patient, and I first started getting sick when I was 14, but I really had symptoms all of my life because Chiari is congenital, and I just thought the pain was normal. But my freshman year, I started going numb on my left side, and I also had scoliosis, so we got sent to an orthopedist who did an MRI and found my very severe Chiari malformation, which was causing brainstem compression and a hollow cord syrinx, which is spinal fluid all up and down my spinal cord. And so we went to a bunch of different neurosurgeons, and then finally we went to Dr. Keating here, and he just made us feel really comfortable and at home. And we decided on him, and we've been at this hospital ever since. And yeah. So things that I love the beach. I love my friends. I'm a competitive cake decorator and and baker. And I used to do gymnastics up until I got sick because Chiari also impaired my balance and coordination, and that's pretty important for gymnastics. And my favorite color is pink, and I love Children's National a lot. I feel really at home here, and I don't associate it with being sick. I associate it with feeling better, and I love all the doctors. They feel like family. So last summer I was a volunteer intern here, and it was really nice. We got to help out at all the outpatient clinics and play Uno all day with the kids. And yeah. So more about my diagnosis. My Chiari malformation was 26 millimeters, and Dr. Keating made my syrinx go away almost completely. I had a full decompression with a craniectomy, laminectomy, thoraiplasty, and Dr. Keating used the ultrasound to see that there still wasn't enough CSF flow, so he also put in a stent in my fourth ventricle. And after surgery, I continued to have problems, but Dr. Keating stuck with me. Even though my surgery was done, he still kept trying to help me figure out my symptoms. And so we ended up seeing a genetics counselor at the Children's Outpatient Clinic out in Virginia, and I got a diagnosis of Ehlers-Danlos syndrome, which kind of helped explain why I was still having issues. And that also impairs my bone density, so I'm a member of the bone clinic here with Dr. Tosi. And so more about my hospitalization. I was here for my original surgery, and then I came back this past summer for intracranial pressure monitoring to see if that was causing some of my headaches and issues, and was here for a couple of days. And then I was also, in 2015, a patient at Inova Fairfax Hospital for gastroparesis because I couldn't keep any food down. But I like children's better. And
All right, so good afternoon, everyone. I'm Melissa Winter, the Program Director of Service Excellence, and so I'm going to moderate some questions first to get us warmed up, but please be thinking of questions that you might have that we can ask our panelists, and even on the WebEx. If you have questions on WebEx, please use the chat to ask the question, and Wayne Neal is here representing you and can ask on your behalf. So I wanted to start, Katie and Maddie, one of the things that I talk about in my work here at Children's National is that one person can make a difference in the lives of our patients and families. And so I wanted you to tell us a little bit more about maybe one person who maybe really made a difference to you, and tell us a little bit more about what they did.
Okay. So my favorite person is Dr. Keating because we went from neurosurgeon to neurosurgeon, and they all were very serious, had already an idea of what was going on, just wanted to get us out of there and schedule a surgery. We still didn't fully understand. And then we sat down with Dr. Keating, and he spent a lot of time with us, let us ask questions, made us feel really comfortable. And I wasn't even scared going into surgery because I felt like he cared about me so much that nothing could happen. And he spends a lot of time getting to know me, and we talk about like trips and places that he's been. And every time I see him, he asks if I have a boyfriend yet. And so I really feel like he's a friend of mine, so I don't mind going to see him, and he's made me feel a lot better, so yeah. Oh, I also wanted to share a story about there was a nurse here when I was an inpatient. I had just had my first decompression surgery, and I hadn't brushed my hair yet, and so there was no conditioner in the room, only shampoo, and so I was really scared to brush my hair, but the nurse went to get her personal conditioner and bring it out so I could use it, and helped out a lot.
One that you can think of, Katie.
Like all of them, made a big impact in helping me, diagnosing me, and finding a treatment. They all work together, as a team.
Mm-hmm. And what I love about your story, Maddie, is that one of the reasons you love Dr. Keating is that he sees you beyond your diagnosis. Mm-hmm. And I think that that's always a really good reminder to each and every one of us, is to see our patients as the person who is a competitive cake decorator, or the person who loves to be a cheerleader. And so what are the things that we can do as part of your healthcare team to make sure that you can keep doing those things that you want to do? So it actually broke my heart that you can't do gymnastics anymore. And so, I'm glad to know, though, that Dr. Keating makes you feel like part of his family and makes you feel so special. But tell us a little bit more about, because often if we're really busy and we're coming on rounds or coming in to see you as a patient in the emergency room, we maybe want to just get right to the diagnosis. But maybe before we start, what's something you would want your care team to know about you before we got started?
So Personally, I feel like everybody here is like really kind and gentle, and I like that. When I want to feel better, I want positive energy around me, so I want somebody to be smiling and laughing with me and not so serious and sad. And like I want people to want to get to know me, like you were saying, because like my medical conditions and my body are personal to me. So if an MRI tech is taking a look at the inside of me, I want her to at least know my name and talk to me first before she takes my pictures.
Mm-hmm. Yeah, I agree. And like so they're like informed about my case, like so I can like inform them more about it if they ask about it, and they can treat me the best they can, and always like be positive and yeah.
And one of the things we were talking about when we gathered before today was that you two, even though it's been in your teens that you were diagnosed, you're really well informed, and that sometimes the team comes in and talks to you as if you don't really understand what's happening. So can you tell us a little bit more, because every patient is different on the level of information that they already know and are aware about their care, but I know you both are really well informed.
Yeah. So I want to be a doctor, so I really like learning new medical terms and things like that. And I've researched my condition so much that I know most of the detailed terms and the terminology. So when a doctor sits down with me and tries to talk to me like I'm a lot younger than I am, I don't like that. But I like the details and everything that's happening. But I understand that some patients don't know the terminology. So I think it's really important to sit down and understand the level of detail that you should go into with your patient, and try and understand how much they already know and how much you should tell them.
Yeah, I agree. And I think that, like, since we, I like to educate myself, and, like, I would like for them to explain things like if I'm getting a new diagnosis, I would like for them to explain it to my understanding too, and so I can like be more aware of my body and what's going on.
And that's true, right? You both are the ones experiencing your health, and so you know what's happening fast. And so having us be able to ask you and get that information is really important. So let's talk about, speaking of all that, the staff members who may be coming in to see you. Have you ever experienced where a bunch of people come in and they're there and they talk and nobody introduces themselves, or you don't know who people are?
Yeah.
Can you tell us a little bit about, because that's one thing that we've been really focused on, is making sure that the members of the care team introduce who they are and explain what they're going to do before they do it.
Yeah.
So can you tell us a little bit about why that might matter to you?
Yeah, so again, when there's people talking about me and my medical problems, I want to know them and I want them to know me and introduce themselves to me. And I think it's really important that they involve us in the discussions, because they look at our charts and know what they know from our charts, but really they have to ask us questions to fully understand like our issues and what's going on. And on another note, it's really important during inpatient rounds to involve the patient, because like this is where you are, this is your life right now, and we want to know what's going on. And sometimes I would accidentally sleep through the rounds and miss them and be kind of frustrated that nobody woke me up. So it's important to know if like the patient wants to be woken up for rounds.
Yeah, and about like, I like how they introduce themselves. Like most of the time I've been here they have, and like if I'm in the operating room, they always seem to introduce themselves, and it makes me feel like more comfortable, and they're all really nice, so I like that.
So one of the things that we're really proud of is this is our 5th annual Patient Experience Week, and I think I mentioned to you that, as Kathy said, we really do listen to your feedback on things that we could do better. And our very first patient, which I may be stealing a little bit of Dr. Newman's thunder here, talked about the Ryan Seacrest studio because he had experienced that at another hospital. So tell us a little bit. I think there are a few things that you think we could do better because you have experienced other hospitals, and granted, you think we do a really great job because we are children-focused. But I think there were some ideas about the outside area.
Yeah, so when I stayed at Nova Fairfax Children's, they had a little courtyard with some balls and tricycles and wagons and things like that. And that was definitely my favorite part of that stay. Like, it was really nice to be able to be out there when it was nice out because you're trapped in a room for a long time, missing the outside. And it was spring. And they had these, like, go-karts that you could attach your IV pole to without even the help of the nurse. You could just move everything over. And so it was kind of nice to be free from the pole for a little while. So I think that would be really cool if we could get some of those at the garden here that they're building. And I like the idea of having activities out at that garden because I think there aren't a lot of opportunities to meet other patients because there are the playrooms, but when you go, everybody goes at different times. So I always ended up it just being me in there. And for things like the bingo, since it's only like once a day or like you might miss it and then be disappointed that you missed your one opportunity to hang out with other people. So maybe other activities spread out through the day or like things like that, like scheduled activities in the room. And I like the idea of scheduled activities out in the courtyard. I think that would be really cool. And another thing is I love the music in the MRI machines here. You're able to plug in your phone at the front and your phone plays music while you're in the MRI. So I think it would be cool if they could get that into other tests and other rooms and things like that because that's a really enjoyable feature. And my favorite thing about being in the hospital is visitors and my friends. And I know a lot of other kids love their friends also. So I think it would be cool to have a program to encourage visitors or maybe a room for visitors. And yeah.
Yeah, I agree about that. Like, it can kind of be boring if you're just sitting in your room all day. And I like the idea about the activities, like, a couple times a week, and the bingo, like, more frequently. Yeah. And, yeah, about the visitors, I think that would be good.
And so I'm going to also ask, you have a lot of family here with you today, Katie, and then Maddie, your mom is here, and I know that Lisa, your mom, has another suggestion as well for us. We were talking about that earlier. So Jen, could you bring them up? So this was about the chaplain. Yeah. So I'm going to introduce Lisa Curtis, Maddie's mom.
First of all, thank you, and thank you for this opportunity. Just so proud of both these girls. I just met Katie today, but I've learned a lot about her situation from her mom, and I know everything that Maddie has been through over the past 3.5 years, and I'm just very proud of her and her bravery. And this hospital has meant a lot to us. You know, what we've gone through has been very difficult, but I have to say I think we both have positive feelings whenever we come here because we've had such good experiences, and the staff has been so welcoming and has explained things. Maddie talked about Dr. Keating, and we really appreciated him explaining exactly what was going to happen during the surgery. And during Maddie's first surgery in April 2014, he didn't know exactly how extensive the surgery would be till he was there. So he explained that it was kind of a two-step surgery, and somebody came out and told us in the middle of the surgery, you know, what exactly was happening and that he had to do this additional procedure to open up the dura for her Chiari decompression. And afterward, he came and explained exactly what he did, and it was a very difficult time, particularly because of 4-hour surgery in that waiting period. And our pastor did come from our church. We're far away. We live about an hour from here, but she came, and that was great. So I guess I wasn't aware of the chaplaincy program here. So I think it would be great to know more about the chaplaincy program. I'm thinking about particularly for parents, but maybe there's issues with kids as well. But I just think it would be important maybe to get that word out, and particularly, like I said, for those long surgeries where you're waiting in the waiting room, it might be good to have a chaplain circulating through there.
Great suggestion. And then since Jennifer is right there, I'm going to have you hand the microphone over to the other Jennifer. So this is Katie's mom, Jennifer. And when we talk about people who make a difference, you talked about Dr. Dabari. Yeah. And can you tell us a little bit, tell the rest of the group a little bit about Dr. Dabari and why he's so special to you?
Yeah, we have really appreciated everything Children's National has done for Katie. We feel like Katie is kind of a very rare thing going on where 15% of people are born with what she has. It's an anomaly in her body, but only 2% develop the syndrome. So it's hard to figure out what she has when you go for something that you think is GI related, and it's actually a gastrovascular issue. So it's really not in everyone's wheelhouse if you're not familiar with this. And Dr. Dabari, as well as Dr. Moak and Dr. Kane, have all been wonderful. They were willing to think outside the box. And Dr. Dabari, we see him for motility as well, because Katie does have some gastroparesis, but he was willing to say, this is what I know, and you need, beyond this, we need to find other specialties to help you with this, so we come together as a team, which we really appreciate him just not saying, I'm just going to give up at this point, or, there's obviously something else going on here. Because when you have things that are very rare and you're trying to search all over the country for the best place to be, it's nice to know that we only have to drive an hour, because before we found out about Children's, we actually flew out to the Cleveland Clinic, and it was a lot of money, and and having to stay, and when it was just the two of us. So being able to come here and find everything we needed here and was just wonderful, and everyone here has just been amazing and really helpful and not giving up on us. So, and this has been the best thing too, is meeting Maddie and Lisa, because you don't really get to meet other patients who have something similar to what you have. Because when you're here, you kind of feel like, when you're a patient, you feel like you're focusing on your own thing. So it's nice to see Maddie and how far along she's come too.
I love that. That could be one of the taglines for our values, if we don't give up. Right. So yeah. We keep going. So I want to open it up to see what questions might be in the audience or on WebEx. Or comments. Stanley.
Hi, thanks for coming here and sharing the positive aspects of your stay and complimenting us so much, because it's hard to get compliments. We solicit them outside by the bus stop. But, I've been involved in a lot of patient experience, value-added mapping. We're trying to figure out how we can make you feel better here. Strangely, and you might not expect this, but it boils down many times to trying to figure out how to schedule patients and how to get them here on time and how to communicate that and work that out. But it occurs to me that that's more for the parents. And I don't know how much of that value you feel, but when we try to look at the value to the patient besides the obvious medical care, but what does the music in MRI add? Right? Are you more relaxed and able to stay still longer?
Yeah.
Or is it just, hey, without this music, I can't take it anymore? But to you, now that you've been through this system and other places, what kind of value to the patient? I love the part that you said, the discussion with the doctor instead of hearing it about you. But what kinds of value if there was something to do better, shoot for the stars. This is what I really want. I love the go-karts idea. In fact, I want to be part of that too. I'm just going to get 90. But what would you, going through all this, is there anything that you could say, hey, listen, honestly, could you do something more along these lines?
I feel like Jordan is already pretty good about this, but asking the patient questions is really important, I think, like directly to us instead of the parents sometimes. I think that's the best way, because sometimes the parents don't like fully understand the patient. And yeah, the go-karts would be cool, and some conditioner in the room, maybe, that'd be nice. But, yeah. Yeah, oh, that's another thing. When they put on the oxygen monitor on your finger, sometimes at other hospitals they'll make you take the nail polish off and things like that. And here they understand that, like, you just got your nails done. So they let you keep it on. And it's really about all the little things. And understanding that the little things matter to us, and so it's easy to like rush past things. And we were talking earlier about a girl who was scared of having her head shaved for her surgery, and I was scared of that too, but Dr. Keating really stressed that it was just going to be like a small strip, instead of, if you just get told you're going to have your head shaved, you might not know what to expect. But really explaining in depth is important, like everything in depth, all the details, because we do understand a lot of medical terms, but sometimes there are things that need more explaining to make us feel comfortable. And
yeah, sometimes if I'm nervous before a procedure, I always like ask them to explain what's gonna happen, so I'm not just like wondering and like getting myself round up of like something that's like nothing. It's not gonna be bad. Like, yeah.
So taking the time to answer your question.
Yes.
Yeah. And both of you, I met you through Child Life Specialist. So can you tell us a little bit about the difference that a Child Life Specialist has made to you in that regard? Because I think that's along the lines of their work.
Yeah, so it's nice to have a person who focuses on things beyond the medical aspect, because obviously when you're getting better, there are things important in your recovery other than just the medical stuff. And when you're here, it can be really boring. So it's nice to have the Child Life Specialist come and like help you think of things to do. And they really get to know you as a person. And yeah.
Yeah, like before and after surgery, Liz brought me Play-Doh to play with for distraction, and like, so I wouldn't be as nervous, and we went back to the operating room together, and it was nice to have someone who understands.
And so our Child Life Specialists are representing in the back of the room here. So Liz and Chris. So Liz Anderson and Chris Bragg are the ones that I feel really fortunate to have introduced me to you for today. What other questions are in the audience? All right. Jennifer has the mic for you.
So you mentioned wanting more activities, and I'll admit that I feel pretty confident in planning activities for preschooler and school age, but sometimes for teens, it's a little hard to know what, besides like an Xbox or talking to your friends on Facebook, what we can do to help you get engaged and new things that we can bring into our hospital to make it, you know, like just having that stimulation and something to do. So when you say activities, what do you have in mind for that?
Well, I think for teens, we really like being around each other and talking to each other, and that's probably the most like fun that we have. So really when I say activities, I mean things that will bring us together. And it doesn't have to be a complicated, like, big game, like, structured thing. It might just be, like, a time when all teams come and can talk to each other and be together. and games would be fun also, but yeah.
What games are popular right now with teenagers? I don't even know.
I don't really know.
When I was a teenager, we played Pictionary. You know that one?
Yeah.
Yeah, okay.
Oh, like board games? Yeah. Like the Uno here is really fun also. I remember the first time we were coming out of my room after my first surgery, my mom was reeling me down the hallway, and every time we would pass the playroom, somebody would call out, "Do you want to play Uno? Do you want to play Uno?" And yeah, so that was good too.
Uno is very popular.
Yeah.
What other questions?
I have a WebEx.
Go ahead.
So this question is in regards to school. With all your appointments, have you struggled with missing a lot of school? And do you think the hours available help you to minimize time away from school?
Yeah, I miss a lot of school. Sometimes not just for appointments, but for symptoms. But the scheduling is nice. It's hard because we live far away, so whatever time we schedule, I'll still probably miss some school. And when you're an inpatient here, you don't want to do schoolwork, so I don't think, like, that would be an issue, because if you're not feeling well enough to do the work, then it shouldn't be pushed. But yeah, missing school is hard. I think there could be a way to maybe connect like your counselors with your doctors, and that would be nice, and maybe work out a program, because sometimes it's hard for the administration and teachers at school to understand that you have medical problems that are more important than making up your test. And so maybe if adults were to talk to other adults, that would be helpful.
Yeah, I'm actually doing half days now since my symptoms are still here, but I do half day in school and half online, and that makes it much easier for me. Instead of focusing like all on the pain in school, I have half in school and half online. So yeah.
Yeah. So I loved, over the weekend, we kicked off Patient and Family Experience Week with our ambulatory surgery or ambulatory services for the clinic staff and the nurses. And Darcel Jackson, who is our brand new Patient and Family Coordinator, is that right? So Darcel, stand up. Introduce her, yay. Gave a welcome and talked with the staff, and one of the things that we were so impressed by is she actually tracked since how many years of appointments? Since 2006, she told us how many appointments they had, and it averaged to about 9 days a year that they spend, Monday through Friday in appointments. And, that means away from work, away from other family members, away from school. So I thought that was a really interesting way to think about it for those of us who really respond to data. So I can imagine it's hard to miss school, especially if friends are, the things you love most about being a teenager. Martha.
Katie, I noticed that you have not...
Hold on, Martha. Can we get you a microphone so the people on WebEx can hear you? And then this will be our last question, and we'll have Dr. Newman wrap us up.
So first of all, Katie and Maddie, you guys did an awesome job. I think we'll be recruiting you for our Youth Advisory Council, which we want to get started here. But Katie, I noticed that you have not one, but two dogs that seem to be really important to you. Can you tell me from your perspective what it would mean to you if our organization were to enhance our pet visitation program, and what that should look like in order to help you and others get better?
Yeah, so I was at another hospital. They actually had a therapy dog come in when I had my surgery, and they're just so calming, and it feels like a great atmosphere, and they're really nice to be around when you're not feeling well, and they always seem to lift your spirits.
that means we need to do more of that.
Yeah.
Okay, thank you.
Yeah.
Well, and if you bring Scout, is it Scout?
Yeah.
Yeah, if you bring Scout, I think you'll have some people who will be, including me, wanting to pet Scout and get some employee pet therapy. So, again, thank you. Katie, do you want to introduce who's all here with you?
Okay, sure. That's my mom. That's my twin sister. That's my grandma. That's my poppy. That's my dad. That's my grandma. That's my aunt. That's my cousin, and that's my grandpa.
So that's great, reinforcement of family, right? That we are family to you, but recognizing that you also have families that you rely on and are included in the care once you leave us in helping you get better. So with that, I can let you guys step down unless Dr. Newman had questions. Okay, so go ahead and you guys can sit back down and we'll ask Dr. Newman to wrap us up.
Well, thank you, Maddie and Katie. You know, it's hard for me to add anything. You guys are just terrific ambassadors for Children's National, and you know, I'm so glad you had an offer to be in her department, because I was worried you might be gunning for CEO there for a while. So I've got a little time left, but you're terrific, and thank you for all your great ideas. I've written a few of them down. I'm glad we're at the top of all children's hospitals in terms of nail polish guidelines, and I'm going to use that with my other children's hospital colleagues to put us up there. You know, I guess for obvious reasons, I wasn't that in tune with the hair conditioner issues, but I will certainly turn to the team to make sure we're doing inspections and have all of those things, just like a hotel. We ought to be at that standard to have that. So thank you. We have made some progress, though, and it's great at this 5th annual Patient and Family Experience Week. So we've been having these, I guess, now as long as I've been CEO. And there's, and, you know, we have learned a few things. I hope, well, you've been inpatients, but I think there was a major change around the food and nutrition. So being able to order from a menu, and I think the families can do that. Is that right? So I don't know whether the food quality is any better, but at least you can order things. But I think the food quality is a lot better, and we've gotten a lot of really good feedback about the different options, and that is so important. You know, the big complaints you get out as being a CEO, one is about food, the other is about parking. So I'm glad we made a lot of progress on food, because I'm not sure we made much on parking, but that whole experience thing, we're trying to get better at that. And I think our meal delivery service is now much more like a hotel service, and I'm pleased about that. We're doing I think, you know, the issues of teenagers and adolescents it's an area that we're still trying to find the right approach, and we've got more to do there. But I'm reminded of one of the first one of these sessions. One of our patients named Nathan, who had been to a couple other children's hospitals, did say, you know, you don't have anything for teenagers and adolescents. You need a studio. He'd been up to CHOP, and they had one there. And so after we raised some money for it, we were able to do the Seacrest studio. Sounds like we could do more with music. I'm not sure what's on your playlist, but it would be a lot of fun to take what we're doing in MRI and push that out through the rest of the hospital. So you guys have great ideas, and I've always wanted to push our teams to be listening. And to take the ideas that our families have and where we can, bring them into the hospital. Sometimes it takes a story or two, and then we can go out and with that story and raise the money that we want to raise to bring that to the hospital, because sadly a lot of these things aren't paid for by insurance. So even though they're meaningful to the patients and families and the whole healing, we have to find other ways of getting the resources to provide the things that you want. But the stories come back to it. When we have these great stories and the passion, that appeals to people, and then I can get out there and really try and push that hard, and that's how we got a healing garden. It took some serious fundraising to raise the money, not just for the garden itself, but to have the child life workers that are going to be able to be part of that, the therapists be part of that the whole time, so that won't go away, that they can schedule those kinds of things. I'm not sure we're going to have go-karts out there, but we do have a lot of things that are important for healing. And in fact, it's been so important, and it really highlights our connection with the First Ladies of the United States, because they come here and want to know about it. But it's gotten, and we're going to have a big dedication for that soon, but we had a very quiet visit last week. The current First Lady wanted to come see it. She heard about this healing garden and the impact it could have on healing and patients. So she wanted to make a quiet, private visit to come out here and see what we're doing. So, and that idea came out of a patient and a family where they wanted to have an outdoor experience. Sadly, it was it was the last thing that she wanted to experience before she passed away. But it took that story that we could tell, and it got a lot of our donors excited, because they wanted to do the right thing. That's what I love about this team that's in this room. We just got so many leaders here, and I can't talk about all of them, but you know, they're just you know, all through here, particularly Kathy Gorman and Martha and our whole Service Excellence team is just, you know, I think right up here at the top. So they've organized this whole week, and we're tomorrow's session will highlight 4 of our teams that have shown significant improvements in patient experience. I heard some data today that we're in the top quartile in 2 areas. We're in the middle on one area, and then we're a little low on on one of the other areas. So we've got a lot of work to do. And our Press Ganey team has been really helpful in helping us measure this, so we have data and we can improve it. So we'll hear 4 of those teams tomorrow at Grand Rounds. We'll hear from a diversity expert, and diversity is one of those things we embrace. It's one of our strengths, and as a nation and as the Children's Hospital in our nation's capital, we want to be very public and open about our feelings and our core values around diversity. So we're going to celebrate that with Hope Fuller, a compassion across cultures. And I think that's going to be really important, because there's a lot of people worried out there right now about things, and we want to make sure that folks know that we want to provide and care for all of our patients and families, no matter who they are or where they're from. On Thursday, we'll roll up our sleeves and then get right deep into it, right, with our language services, and make sure we're serving our non-English speaking families as best we can. And I'm thrilled that we are working on right now, and I don't know how close we are to the rollout, but I've seen some of the samples with our Spanish version of our website, and that is soon to go live, right, Martha? Yes. Within the next month, and so that is going to be really cool. We're going to lead as a children's hospital in terms of getting our website accessible to families from the Spanish language. So, and to me, this week is just it's a chance to thank each of you, and when I see you, I'll be doing that. Our work is, it's incredible. A week doesn't stop on Friday, but this week we're going to celebrate on Friday, and we are going to have a celebration and some fun. But I know that the teams that are here all night long and all through the weekend, they're part of our entire service excellence. And that's one of the things I've been worried about is, if I had a chance to ask you a question, I would have asked you, what's it like here on the weekend? Because I worry sometimes, I know we have only one thing of bingo during the week per day, but do we have bingo on the weekend? Or, do we have the kinds of things you need? Because when you're a patient in the hospital, you don't know whether it's Saturday, Sunday, Monday, or Tuesday. You're just here trying to get well. So anyway, that's a little challenge for my team. I'll probably have about 20 emails between now and when I get back. Oh, yes, we do this and we do that and we do that. But just thought I'd stir it up a little bit. That's what I love to do is stir it up. That's what Children's National, that's why it's fun to be the CEO of this great organization, because we've got a team that loves to get stirred, and they usually get to higher performance. And I just want to end by saying thank my friend and colleague, Melissa Winter, who really has put all this together. I don't think she would agree that she loves to get stirred, but I love to tweak her, and she usually comes in way above what I thought she'd do, and this is just part of that. Just a great patient and family experience week. I'd love to see this whole thing filled up with all the grandpas and poppies, and I don't know who all else you are, cousins, and every other which way, but it's just great to have you all here. So thank you all very much.